Prolonged stretch. It is the application of slow passive lengthening of a muscle inhibits its contraction. Positioning in the elongated position to cause lengthening of the spindle to reset the afference of the muscle spindle to a longer position so they can become less sensitive to stretch. Its stimulus is a maintained stretch in a lengthened range. Its receptors are the muscle spindle ending and Golgi tendon organ. The response is that it inhibits muscle activity and it has a damping effect. Deep pressure. It is the application of manual pressure across the longitudinal axis of the muscle tendon that causes relaxation of the muscle. Deep pressure can be used in spastic or tight muscle. The stimulus is a firm pressure manually or with body weight over muscle belly or tendon. Its receptors are the Golgi tendon organ, muscle spindles, and tactile receptors. The response is that it also inhibits muscle activity and it has a damping effect. Approximation or light joint compression. It can be weight-bearing or non-weight-bearing. It is the compression of joint surfaces. It can be manual or mechanical. It is effective in combination with rhythmic stabilization. It is contraindicated in inflamed joints. Its response is that it enhances muscular contraction, proximal stability and postural extension. It increases kinesthetic awareness and postural stability. Approximation with rocking. It is a rhythmical circumduction of the head, upper extremity, and or lower extremity, and a slight approximation is given. During the technique, the weight is shifted forward and backward, progressing to side in diagonal patterns. Slow rolling. It gives a generalized calming effect. The patient is rolled slowly from sideline position to prone and back in a rhythmical pattern. It is used on both sides of the body.
Prolonged icing. It is an application of an ice massage over the forearm flexor muscles, leads to its relaxation and reduction of pain. Slow icing. It is the slow stroking motion while applying ice to the affected area. Slow vestibular stimulation. Stimulus applied is slow rocking, slow movement on ball. The response of the patient is that it produces calming effect, decreased arousal, generalized inhibition. It is useful for patients who are defensive to sensory stimulation, hyperactive to stimulation, hypertonic, or agitated. Slow stroking. Slow stroking with the hand along midline of the back near the posterior rami for 3 to 5 minutes leads to calming of the patient. Stimulus applied is slow, firm stroking with flat hand over the neck or trunk extensors. The response, it produces calming effect, generalized inhibition, induces feeling of security. It is appropriate for overly aroused patients. Neutral warmth. It is wrapping the patient's forearm with the use of blanket for general relaxation. We will applying it for 10 to 15 minutes. We will avoid overheating. Appropriate for highly agitated patients or individuals with increased sympathetic response. Heavy joint compression or approximation. It's applying compression on the shoulder joint that will stimulate co-contraction of muscles around the shoulder.
Intrinsic stretch. The patient will be positioned in a quadra position, whereas the elbow is in a 90-degree position and the patient is holding a towel. It promotes stability of the scapulohumeral region, bearing more weight on the ulnar side of the hand, and promotes resistive grasp. Intrinsic stretch happens when patient tries to grasp the object. muscle spindles will be activated and are lengthened. Secondary ending stretch. It is the combination of resistance and stretch to facilitate ontogenic patterns. The PT will apply resistance and will slowly stretch the target muscle. This allows the muscle to contract with combination of lengthening. Quick stretch. A quick over-elongation of the muscle facilitates contraction of the muscle. Produces contraction of the agonist and inhibition of the antagonist to facilitate contraction. In the video, we are trying to improve the patient's knee flexion, so we are going to apply a stretch towards knee extension. Tapping involves brisk taps with fingertips or knuckles over the muscle belly to facilitate basic contraction of this muscle. Fast brushing or light moving touch. Application of quick light strokes to the skin over a muscle using either fingers, cotton, or a brush. This facilitates contraction over the underlying muscle. Apply it over the dermatomes of the same segment the muscle supplies for 3 to 5 seconds and repeat after 30 seconds. Apply this directly to the skin.
For quick icing, the receptors are muscle spindle endings, detecting length and velocity changes. Ice can be used to facilitate a muscle response, which uses a combination of coolness and pain sensation to produce the desired response. This is used for patients with hypotonia. It provides relaxation and alerts the mental process. So basically, you just have to swipe directly over the muscle belly and blot the water afterwards. So for the vibration, muscle vibration has been used as a technique to reduce muscle tone and spasticity in individuals with neurological conditions. Vibrations of the muscle are thought to increase corticospinal excitability as well as inhibitory neuronal activity in the antagonistic muscle. Muscle vibration is generally applied directly to the chosen muscle or tendon and may be applied in two ways. These are the high-frequency vibration and the low-frequency vibration. For traction, the receptors are the joint receptors. So this is the separation of joint surfaces to activate joint receptors. It facilitates muscle activation to improve mobility, and also it is theorized to promote movement. For fast vestibular stimulation, receptors are your semicircular canals. These are fast or irregular movement with acceleration and deceleration component. It provides powerful proprioceptive input and promotes extensor patterns of the neck, trunk, and extremities. It can be used to activate anti-gravity muscles as well as their antagonists. And fast stimulation such as rocking stimulates, while slow rocking causes relaxation. For resistance, the receptors are the muscle spindles. This is given by body weight or gravity, manually or with mechanical weights. It enhances muscle contraction through recruitment, it facilitates synergists, and enhances kinesthetic awareness.